In this video, I'm going to show how to relieve sciatica in seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy and safe exercises that can offer instant sciatica pain relief, even within 30 seconds. And to make it really helpful, I'm going to show the exercises in different positions. That way you can get relief anytime and anywhere. Just as a quick note, each one of these exercises works differently. To get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. Here's a couple good exercises that we can do in bed or on a floor. Just lie flat on your back like this. Have your legs roughly hip width apart, knees bent, feet flat. The first exercise is called a sciatic nerve floss. It's going to help take tension and pressure off the whole sciatic nerve pathway from your lower back all the way towards your foot. So whatever side that you're having sciatica, let's say it's our right leg, what we want to do is lift that leg up, take our hands cupped right behind our knee. Now slowly pull your knee towards your chest until you feel a light stretch only on the back of your leg. You're going to hold this and now slowly straighten your knee, lifting your foot towards the ceiling. Do this slowly because you are going to feel a very deep stretch form. You want to build into this one as much as you can to the point where if you went a little bit further with it, it would start to cause pain or discomfort, but definitely don't go to that point. We're going to hold this and now really take it to the next level by doing a pumping motion with our foot. So imagine pressing into a gas pedal. You're going to press your foot away from you, and as you do this, you're going to feel a really good stretch work downward into your calf muscles all the way towards your toes. Hold this comfortably for a second or two, and then you're going to bring your foot towards you and repeat. You're going to notice it stretches the muscles a little bit differently. So I like to do this pumping motion back and forth about 5 times, and then I release it, take a breather. You want to do this whole cycle about 3 to 5 times, and with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it's helping out, but there's still some tightness or pain left, keep repeating this over and over again until everything is nice and loose. So another exercise that we can do is called the figure 4, and this one is going to target a couple different muscles, including the glutes and the piriformis, which can compress that sciatic nerve, leading to sciatica pain in our legs. So whatever side that you're having sciatica, again, let's say it's our right side, let's take that side's ankle and place over our other side's knee. So when we look up, should look like a figure 4. What you want to do is scoot this bottom leg towards you a little bit until you feel a light stretch forming over the painful side's hip. We're going to hold this and now take this bent knee and press it away from us, but don't use your hands. Instead, use your leg and hip strength, because the more that you press away, the more that you're going to feel a deep stretch form over the buttocks and over that hip. Build into this one, hold it comfortably for 20 to 30 seconds, release it, and then repeat this 3 to 5 times. And again, with each repetition, try to build into it just a little bit more. But go through both of these movements. You'll probably find that one just offers more relief, and at that point, throw more repetitions in until everything is nice and loose. Here's some really easy exercises that we can do seated. Whatever side that you're having sciatica, let's say it's our right side, we're going to straighten that leg, rest our heel on the floor, toes pointed towards the ceiling. Other leg, we're going to have our knee bent, foot flat. So the first thing that I like to do is just warm up that whole sciatic nerve pathway. So you're going to take your foot and you're going to press away, kind of like pressing into a gas pedal. As you do this, you should feel a really good stretch form pretty much from your hip, working down the leg into your calf muscles all the way towards your foot. Build into this one as much as you can. Hold it comfortably for a second or two, and then you're going to slowly bring your foot towards you. At that point, the stretch is going to be felt a little bit differently, but you want to build into this one as much as you can. Again, hold it for a second or two, and then just as a fluid movement of pressing away and towards you, keep going back and forth over and over again for about 10 to 15 repetitions. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it's really helping out, but there's still some pain or tightness left, keep throwing repetitions in until everything is nice and loose. But if you would like to take this movement to the next level and get a much deeper stretch, you can do what is called the slump stretch. So for this one, I like to start by pressing my heel downward into the floor until I feel a light activation of the muscles around the hip. targeting the glutes. We're going to hold this and now bring our foot towards us as much as we can until we feel that deep stretch in our calf muscles. We're going to hold this and now take our chin, tuck it towards our chest, and now round or slump our upper back and shoulders forward, lowering our chest towards the floor. Do this slowly because you are going to feel a deep, intense stretch from your lower back into your hip, down the leg, into the calf muscles, all the way towards your toes, that whole sciatic nerve pathway. Hold this comfortably for 5 seconds, release it, take a breather, and then repeat this 5 to 10 times. With each repetition, again, build into it a little bit more. But I would go through both of these movements. You're probably going to find that one just helps out a little bit more. And at that point, keep throwing repetitions in. So here's another really good seated exercise to try. Whatever side that you're having sciatica, let's say it's our right leg, we're going to take that side's ankle and rest over our other side's knee. So when you look down, it should look like a figure 4. If you have a lot of difficulty getting into this position, to make it easier, straighten your other leg out, put your ankle over the other side's shin. That way you can grab your pant leg or in front of your leg right here to slide it into position. So the first thing that I like to do is to take my hands and I cup right around my knee, and I'm going to slowly pull this knee across my body towards my other side shoulder. As you do this, you're going to feel a really deep stretch form on the outer part of your thigh, working towards your hip and then pretty much across the buttocks or the glutes. This one is really going to help stretch the glutes and the piriformis, again, that can compress that sciatic nerve. Hold this comfortably for 20 to 30 seconds, release it, and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. But to take this one to the next level and get a much deeper release, this is what we can do. Let's take this bent knee and press it straight down towards the floor, but we're not going to use our hands. Instead, we're only going to use our leg and hip strength. The more that you press down, the more that you are going to feel a deep activation of those muscles across the buttocks. Once you feel that, hold this comfortably for 5 seconds, release it, take a breather, and then repeat this 5 times. And with each repetition, just try to build into it a little bit more. So if you would like to get even a deeper stretch by doing this, you can start to add in a little bit of a forward flexion, but with this one, go very lightly with it. And if it causes any more pain or discomfort, please discontinue that movement. So it looks just like this. We're going to press that knee downward, feel the activation around the buttocks, hold that, and then having our back nice and straight, we're going to lower our chest towards the floor. It will quickly deepen that stretch. So if this feels good, hold it for 5 seconds and then repeat this 5 times. But go through all of these movements. You're going to find one that just works a little bit better. And at that point, throw more repetitions in. Here's some really good exercises that we can do standing. The first one is called the wall lean, and all we're going to need is a wall. So the hardest part about this exercise is just knowing which side to place closest to the wall. So remember, whatever side that you're having sciatica, you want that facing away from the wall. I'm going to demonstrate what to do if you have left-sided sciatica. So we're going to start with our feet together, spaced roughly a foot, foot and a half away from the wall, and then we're going to lean our shoulder into that wall. So our whole upper body is pretty much flush against it. It's really important during this exercise not to lift your shoulder off the wall. Instead, all movement comes through the hips. So let's take the hand on the other side, place it right over our hip, and now slowly press our hips towards the wall. But do this slowly because you're going to feel a really deep stretch form in your lower back. Once you feel that, hold this for 20 to 30 seconds. And during that time period, just do nice, slow, controlled breathing. Let out as much tension as you can. You're going to release it, take a breather, and then repeat this 3 to 5 times. And with each repetition, try to build into it just a little bit more. To make this stretch a little bit deeper, what you can do is slowly walk your feet away from the wall and then repeat. The further that your feet are out, the deeper it will be, but go only to your comfort level. So let's take this one to the next level and throw in another movement to see if we can get some more relief. This one is called standing back extension. Really good for bulging and herniated discs. the main cause of sciatica. So you're going to start standing with your feet a little bit wider than your hips, and then lean backward, placing most of your body weight over the middle part of your foot onto your heels. From there, you're going to take your hands and cup around your waist and your lower back a little bit above your belt line. What you want to do from here is take your thumbs and press into the muscles off to the side of the spine. The movement is really straightforward. We're going to gently press in with our hands and our thumbs while we lean backward with our shoulders. This puts the back into extension, kind of like an arching motion like this. And you're going to feel a light stretch form in your lower back. Built into this one, hold it comfortably for 5 seconds, release, take a breather. On the next repetition though, we're going to just raise our hands and thumbs up slightly and then repeat, doing this the whole length of our lower back. What you're going to find is that one certain spot just offers the most relief, like right here for me. At that point, I like to stop over that spot and now throw more repetitions in, but I hold it for longer, more towards 20 to 30 seconds, and try to do this about 3 to 5 times. But I would go through all of these movements. You're going to find one that just offers the most relief. And at that point, keep throwing repetitions in until everything is nice and loose. A major cause of sciatica is due to weak muscles in our lower back and hips that lead to bulging and herniated discs and issues like piriformis syndrome. Here's a really good strengthening exercise that you can use daily or 2 to 3 times a week to strengthen these muscles. We're going to start lying flat on our back in bed or on a floor. Have your legs roughly hip width apart, knees bent, feet flat. Take your hands, put them off to your side for support. The first movement is taking your heels and driving them downward until you feel a light activation of the muscles around the hips. You're going to hold this and now press your hips straight upward towards the ceiling until your body roughly is in a straight line from your knees to your hips to your shoulders. If you're unable to get into this position due to pain or weakness, like you can only go up a little bit, do the best you can. Hopefully over time you will gain strength and flexibility to get into this position, but you're going to feel a ton of muscles start to fire. The core, your back, your butt, your legs, everything that supports those spinal discs and our hips. Hold this comfortably for 3 to 5 seconds, release it, take a breather, and then repeat this 5 to 10 times. And with each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. But let's take this one to the next level and focus a little bit more on the glutes, a main stabilizer of both the hips and the lower back. This time around, we're going to put our feet together and then press our knees downward towards the floor until we feel a really good stretch forming on the inner part of our thighs, working into the groin and then finally into the hips. Once we feel this, now we're going to lift our hips upward towards the ceiling to try to get back into that position. This time around though, you're going to feel it a lot more across the hips, especially on the outer part of your hips. Hold this comfortably for 3 to 5 seconds, release it, take a breather, and again, repeat this 5 to 10 times. But if it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below and I'll get back to you as soon as I can. Thanks for watching.